Communication is critical to a hospital's workflow and productivity, and to each patient's satisfaction. With that in mind, the 617-bed St. Francis Hospital and Medical Center in Connecticut sought to integrate mobile devices with its Rauland Responder 5 nurse call to further improve communication, reduce noise, and gain detailed reporting. When middleware couldn't meet those needs, St. Francis didn't hesitate to add Responder 5 and Direct Connect to get a system that was reliable, self-sufficient, and integrated with mobile devices and EMR. Responder also delivered comprehensive reporting on staff and patient call activity and an open architecture with the ability to grow with expansion.
So basically, we had wanted to improve our patient satisfaction on our nursing floors, and we had a lot of complaints that we had slow response to call bells. At that same time, we had purchased the Rauland system and separately purchased handheld Cisco phones. And what we wanted to know is was there some way that we can make the two connect in order to allow us to improve some of the situations that we had with improving patient quality. So before using the Direct Connect system, we tried using a middleware product to connect the call buttons at the bedside with the phones, the handheld phones that the staff members use. And it didn't work from day one. We had problems from day one in regard to the fact that there was a length of time between the point that the patient pushed the button and the time that the staff member received the response on their handheld device. And sometimes actually they didn't receive it at all. Once we got the Direct Connect system, took out the middleman and went straight between the two setups, all that disappeared immediately. We started on day one and we had response to all the staff members during emergent situations, and the patient calls went through literally immediately. We used to have an average of 5 minutes between the point of the patient calling for a response to the nurse from the nurse's station, and it's now down to an average of 12 seconds. We looked at all the latest technologies, and in the end, Responder is what gave us what we needed.
We needed a system that would connect these devices together in a seamless, streamlined fashion. After a review of our existing systems and the processes that we'd put in place, we found that Direct Connect was the best solution for us. We have a streamlined connection, we have very few delays, and we don't hear too much in terms of the need for support.
We had a lot of bells going off, and after we implemented the system, the overhead paging was eliminated because the calls went directly to the handheld devices. It's amazing how much quieter the nursing units are with the Responder system.
With the Responder system, we see the improvement in patient satisfaction. We are receiving the Press Ganey reports on the monthly basis, and I do compare the report, and there is a positive impact. And also the weekly rounding with the patients and family, also the responses are much more positive with using the Responder system. Just a push of the button, the right message goes to the direct people, and we have a very quick response.
With Direct Connect and Responder 5, there's a patient station on the wall in the patient room. It's very easy to go into the room and press a button and be able to contact one another. The RN can find the CNA can find the RN, and either the CNA or RN is able to quickly find a doctor and allow them to know that they are in the room for more efficient communication. With the phones that we're using with Direct Connect and Responder 5, we are getting the calls much more efficiently, faster. The code calls, the workflows, everything is just done in a more efficient and faster manner now.
What is really good about the phones is the fact that before the nurses even enter the room, they have that conversation with the patient. So if there's something that the patient needs besides the nurse to come into the room, that nurse can also bring that into the room, and it saves a lot of steps. Since we've received the phones, my complaints have decreased tremendously.
The other thing we didn't have before is we didn't have any information in regard to the productivity of our staff members. We'd have complaints from nursing staff that some people responded faster than others or what have you, but we had no way of proving any of this. So with the Direct Connect, we now have reporting. And with that reporting, we are able to determine the speed at which the calls get answered, but also how many calls are answered by individual people in a given period of time, so we can compare staff members with like assignments.
The responder system gives me the ability as a nurse manager to track what is the response rate when the patient calls for help, what is the time when the caregiver responds. So it kind of gives me opportunity to follow up and make sure that the patient's needs are met in timely manner.
Our patient satisfaction scores have gone up since the use of the responder system, and I think not only staff, but I think patients are happier. Nurses seem to be in the rooms a lot more frequently. They seem to be communicating with the patients more frequently. And if there's questions that need to be answered, they seem to be answering those questions a lot quicker as well.
So the responder system help us tremendously with reducing the noise level on the unit, and also help us with the patient satisfaction results and improving the communication between the caregivers.
Our plan to go forward is to bring the responder to all our nursing floors. As a matter of fact, we actually have nurse managers call me on a daily basis wondering when it's their turn to get the system on their floor.